Hello, everyone, and welcome to the webinar, Montana Integrated Behavioral Health Behavioral Activation. Before we begin, I'd like to introduce myself. My name is Leah Sims, and I'm the Project Coordinator for Practice Improvement for the National Council for Behavioral Health, and I will serve as your moderator for this webinar today. Again, before we begin, I would like to cover a few housekeeping notes. Today's webinar is being recorded, and all participants are currently in listen-only mode. You can find the call-in number for the webinar on the right-hand side of your screen. Please make sure to enter your audio PIN, also provided with your call-in information in the GoToWebinar window. You may enter your audio PIN at any time during today's session by pressing pound, followed by the audio PIN number, and then pressing pound again. Entering your audio PIN is the only way that we will be able to unmute your line during the Q&A session. If you have a question or comment throughout the presentation and would like your line to be open, please use the raising hand icon and we will unmute you. Alternatively, questions can also be submitted throughout the webinar by typing your question into the dialog box to the right of your screen and sending it to the organizer. Depending on the question, we may type an answer back to you, interrupt the speaker to ask it, or save it for the end. We'll answer as many of your questions as time allows. Following the webinar, we invite you to please complete a short survey. An audio version of the entire webinar and a PDF of the presentation will be archived on the Montana Healthcare Foundation website page. Additionally, you can download the handout of the PDF of slides at any time during the webinar in the handouts pane on the right-hand side of your screen. If at any point during the webinar you experience technical difficulties, please call Citrix Tech Support at 888-585-9008. So without further ado, I'll pass things off to Joan to get us started.
Hello, everybody, and welcome to another in our series of webinars of evidence-based practices in integrated care. And many of you have met Verna Little on our site visits or on other webinars. And Verna has strongly recommended our presenter for today, and I reviewed the slides and had a brief conversation with him, and I'm very excited to welcome Giorgio Chatelain, and I know I just massacred his name, so I'll let him correct it when I'm done, but he is the Manhattan Regional Director of Psychosocial Services at the Institute for Family Health in Manhattan, and he oversees 6 mental health programs, 2 mental health outpatient clinics, 2 school-based mental health programs, and 2 satellites providing mental health services within homeless sites. And he still is with us today to do this webinar, which is unbelievable given that list. He has over 15 years of experience working with adults, children, adolescents, and their families in a variety of settings, including inpatient, outpatient, and private practice. And he is passionate about supporting and creating long-term strategic plans toward integrated practice and overall operational excellence. And I am really looking forward to hearing from him and hearing what you bring to us. Thank you so much for making time for this to happen this afternoon, Giorgio.
Well, thank you for having me. Hi, everyone. Good afternoon. I'm used to doing presentations in person. Every time I do a webinar, it takes me a while to adjust to the fact that I'm not receiving feedback from the audience directly. So please utilize the chat option. If you have questions, they'll interrupt me so I can answer some of those questions. It'll help me feel like it's more interactive. And I appreciate all the questions that are going to come up. Before I get started, just kind of talk a little bit about what we're going to go over. Behavioral activation is a therapeutic intervention, and in terms of the context of which you're going to find it in your collaborative care and the integrated care. And I think a lot of you have already are probably at a different level or at different places in terms of having it happen in your agencies and your clinics and organizations. But really, if any of you or all of you have either done the problem-solving treatment and or are about to, this is works hand in hand with it. It's not instead of, it works in partnership with it. For those of you who've done the problem solving, there's a whole piece that speaks to specifically scheduling an activity, and behavioral activation speaks to that and is the therapeutic intervention that allows that to happen. So this is not a therapy by itself, it's a therapeutic intervention. And there's some tools and some skills in which we're going to look at that you can utilize when working with patients, specifically that are dealing with symptoms of depression, which is where this all fits into the collaborative care that you guys are doing. If anyone has any questions about that before I get started, let me know. If not, I'm going to move on to the first slide. So again, looking at behavioral activation, and I'm going to start off by saying that everything that I'm going to go through is really simple and straightforward. Those of you who have been in the field for a long time, or those of you who are maybe new to the field, there's nothing that I'm going to say in here that is complicated or new. But it is effective and efficient when working with patients that are dealing with symptoms of depression and really kind of trying to manage those symptoms in a way that makes sense for them. And as simple as it is for us as practitioners to kind of think about and do, it's important to understand that when patients are dealing with these symptoms and they're struggling with them, that they're not always able to see things that are this simple because they're so caught up in the lack of motivation, lack of energy, the lack of involvement in activities. And the tools that we're going to go through specifically are just ways to really get them to think about it, to go through them, and really get them looking at how to participate in activities that they used to do that they're not doing anymore. So when we're thinking of the cycle of depression, we know that there's a lack of engagement in the environment, which contributes to depressive symptoms, and depressive symptoms also contribute to a lack of wanting to engage in your everyday activities in your everyday life. So those of you who've worked with patients dealing with symptoms of depression know that, there's a lack of energy, lack of motivation to get up and go out and do things that they used to do, go out with friends, necessarily go to the park, go to the gym, go for a run, whatever it is that they were doing before, their symptoms are contributing to the sense of not wanting to do those things anymore. And at the same time, the fact that they're not doing these things contributes or continue to feed their symptoms of depression. So with behavioral activation, what we're really trying to do and to look at is specifically find a therapeutic intervention that will disrupt this cycle. Next slide. So these are the core principles of behavioral activation. What it is that we understand that challenges in life can lead to depression. And sometimes they're situational and they lead to symptoms of depression for that particular moment in time. But either way, challenges in life can lead to depression. And often people think that behavior versus motivation are two different things. And what often is confused is that people think that you need motivation. You need to be motivated for you to do something. And it's not that that's not true, but often what it is that if you actually start taking the steps towards a certain activity, once you start taking the steps towards it and you get it started, the motivation comes. You're not always motivated to eat kale, but if you start taking the steps towards having a healthier diet, start taking the steps towards actually eating better, and you actually start eating better, then the feeling that you get from eating better and everything that does helps create the motivation for you to continue. So in behavioral activation, what we're really looking to do is to help them take the steps so that they can actually start gaining the motivation to continue these activities that they were doing before. It focuses on creating a structure and scheduling activities and following a plan. We're going to talk a little bit about what that structure is, taking very specific things that they can do and write down so that they can actually start plotting things in a very organized, very specific way. Really what we're looking to do is emphasizing re-engaging patients with activities that they previously enjoyed. And we're going to speak to the fact that the reason it's important for them to do activities that they used to do and not new activities is that what we don't want to do is create a situation where they might fail. We really want to make sure that they're doing things that they used to do. We're not introducing them to new activities, things that they used to do, because it's easier to schedule that in and to come up with a plan on how to re-engage in those things. So if someone has never skydived, the goal of behavioral activation is not to get them to join a skydiving activity. I'm telling you that when I do that in person, it kind of brings up laughs. I'm not sure how that's going over now in the webinar, but I'm going to continue. I hope all is good. So in this role, specifically when you're looking at behavioral activation, and for those of you who've done the problem-solving treatment training, they speak of the fact that what you are is not a therapist when you are using PST, but you are a teacher. And when you're using behavioral activation, again, you're not a therapist, you're not even a teacher, you're more of a coach. And because you're encouraging them, you're activating them, you're helping them plan these things, you're directive in a way that you wouldn't be as much in therapy, depending on your approach. You are directive in the problem-solving treatment because what you do is you're teaching them and you're being really transparent about the skills that you're teaching them. And here as a coach, what you're really doing is supporting them and encouraging them and helping them find the things that really can get them active and engaged again. I'm going to move on to the next slide unless people have any questions so far. All right, this is a great little cartoon. I like it because the goal of this is not to come up and create big changes or big drastic activities. It's really to engage. If they used to run marathons, the goal of behavioral activation is not to get them to start running marathons again, but it is to get them to start taking steps towards either running and or even taking walks that gets them active and out, something that they can start doing that they were doing before. So if it is hiding the remotes for them to walk around, then that's kind of a funny joke. But it's really to understand that the point of this is that it doesn't have to be huge, large, big things. When we're working with patients who are dealing with depression, oftentimes the issue is that they're burdened by how huge everything is and how big their problems are at that particular time. Maybe not all the time, but at this point in time, they feel overwhelmed by how huge everything is. And what we want to do is help them break things down into very small pieces that they can actually handle, manage, overcome, and succeed at. So as a coach in behavioral activation, as a teacher in problem solving, what we're looking at is helping them find things that they can accomplish and succeed at so that they gain power back over their lives in a place where they feel like they've lost some power, specifically with their symptoms. And really, that combination helps them regain some motivation that they can actually take control over some of the situations that are going on that don't solve the situations, but make them feel more empowered to feel like they have control about addressing them and dealing with them. Next slide. Evidence-based for behavioral activation. It has been found to really be effective and as effective as CBT, even more effective than CBT, equivalent for treating depression as medication is as dealing with depression. So this is not to say this is better than medication. It's equivalent in terms of what the research shows of its impact and its effectiveness in addressing symptoms of depression, and how really, if you use this properly and you introduce it to patients properly, they can really get some shift and changes in their symptoms just by connecting to an activity and doing something they used to do through the work that you're going to be doing with them. So hand in hand with the works you're going to be doing with primary care, if medication is an option, it's a good option, but for some, they don't want medication, and using behavioral activation in combination with PST has a huge impact in helping reduce symptoms of depression for the patients that you're going to be working with. Next slide, please. So what is behavioral activation? It targets a pattern of avoidance, withdrawal, and inactivity. it helps create a structure and a plan so that people can re-engage with their everyday lives. It helps improve their mood by engaging in pleasurable activities. So what's great about this is that it's brief, it's easy to use, it's specifically targeting the avoidance and withdrawal aspect of the patients that you're going to be working with. And it's specifically looking at helping them re-engage into activities that they used to do, which will help them improve their mood, and improving their mood will help them then be able to address or deal with whatever else that was going on that contributed to their symptoms of depression. Even if it's something that necessarily situational, but they might have had pervasive and it comes in cycles, just re-engaging in activities by itself is something that can help lead to improving their overall mood and their overall engagement. Next slide. So we want to help them reestablish routines. We want to help them increase their positive experience to breaking the cycle of depression, and to be able to apply the skills learned for future and decrease recurrence of depression. So just like problem solving, this is something we want to teach them. We want every step of the way for it to be really clear so that when they're not necessarily engaged with a professional, that they can use these skills and these tools on their own. If they're ever feeling that their symptoms are coming back, they're feeling a lack of energy, the tools and skills and the ways that they're going to be going through them with you is hopefully what they can do and reinsert into their own lives on their own. And, if they need the extra support, then they come back in, of course. But this is what the goal of this is so far. So again, nothing that I'm saying is really complicated. It's really straightforward. We're looking at really helping people re-engage in activities they used to do. And we're going to do that by a set of tools, scheduled activities, scheduled plan for them to come up with so that they can re-engage into things that they used to do and help that reduce their symptoms of depression. I'm guessing that you agree that this is simple because I haven't gotten any questions yet, but if there are questions, please let me know as we're going through this. But this is where we're at, and we're going to kind of talk through some of the tools and activities that you can actually do with the patients directly. Next slide. So again, this is going to break down the treatment rationale. Increasing healthy behaviors helps decrease depressed behaviors, has a positive experience, and then you have improved thoughts and mood. So by increasing their healthy behavior, which is what we're trying to do by getting them to re-engage in activities that they used to be in, will help decrease their depressed behaviors, and then they're going to have a positive experience, which overall helps improve their thoughts and their mood. So this is the treatment rationale. This is what you're going to see in behavioral activation. And again, in hand with problem solving, because it's a whole component of it. This is what you're going to help encourage and teach the patients to do to help get them to a different place. And it's important to help show this picture. I like diagrams, like pictures, especially when you kind of talk to patients and trying to explain to them what you're doing and why you're doing it. Because sometimes it might feel silly. It might feel like this is pretty straightforward for them and for you as a clinician. But using this as a diagram to kind of walk them through it is really simple, it's pretty straightforward, and then you move into the next steps of what you're going to be doing. Next slide. So these are the steps of behavioral activation. They're pretty straightforward. There's activity monitoring, and we're going to talk about that in a second, how the patient is spending their time now. Activity scheduling, focusing on identifying what the patient used to like to do and what they're doing now. What positive activities could be added into their day to boost their mood. Creating an activity plan. This is something that's going to be very specific, an activity a day at a time. And we're going to go through that a little bit more. And then reviewing progress. There's nothing in here, again, that is very complicated. We're talking about 4 steps in this process. The 4 steps are pretty straightforward. And I keep talking about how simple it is and how straightforward it is. And from my experience of trying to do it myself and also supervising workers who use behavioral activation or other treatments that seem to be really simple and easy, is that the simpler and the easier it is, sometimes the harder it is to actually kind of stick to it and do it as it's set up. Mainly because we give ourselves allowances because we feel like it's just kind of a simple concept and tool. And again, there's not much to this. It's really 4 steps, but I encourage you to really pay attention to what you're doing and when you're doing it and the reason why. It's also really great to explain this to the people that you're working with as you're working with them so that they're aware of it and that you're both in it together. Again, different than therapy where there's work happening that is not necessarily a transparent work, but you're really working and supporting the patient, depending on what your therapeutic approach is, on supporting them without teaching them what your tools and skills are. In both problem-solving treatment and behavioral activation, you're actively teaching the patient what it is that you're doing with them, because the goal is for them to learn these skills and tools for them to utilize it on their own. So in both problem-solving treatment, where you are a teacher, and in behavioral activation, where you're a coach, your goal is to teach so that they can learn and move and do this on their own. Next slide. Activity monitoring. So this part is, how is the patient spending their time now? You want to review both the positive and the negative and look at ways that they can reduce their negative. Now, when you're talking to patients, oftentimes, you ask them if they're doing any fun activities or anything that they're doing that they're enjoying, and they really say nothing. There's nothing that's giving me joy. There's nothing that's giving me pleasure. And it makes it hard for you to really kind of find out what's going on. And that's really, their symptoms that are playing into it. It's hard for them to recognize it. So this is where you want to use a tool. And I think I sent some handouts, and one of them is activity monitoring. And the way it's broken down, it's looking at every day of the week and all the times of the day. And you can do this with the patient. You can have them do it before they come into session, while they're waiting for the session. It really depends on the literacy of your patient and your relationship with them. But I feel like this is a worthwhile activity to do with them in the room. And it's really having them list out all the activities that they're doing throughout the day and then rate them. And the idea of this is that sometimes patients feel like there's nothing that they're doing that they enjoy. Everything is a drag, and it's really difficult to kind of get through things. It makes it really hard to feel like you're getting any interest out of anything that you're doing. And they feel like they're just kind of completely depleted from any joy that's going on right now. And that's why they have lack of motivation and lack of effort. But sometimes you can have them list out their day, and in their day, they'll list, I don't know, doing the dishes in the morning, making coffee, possibly getting ready for work, coming home, folding laundry, preparing dinner, and watching TV if there's children playing with the kids. And if you have them rate them on a scale of 1 to 10, it doesn't mean that everything is going to be a 10. But if some activities in that day are even a 5, and there's other activities that are a 6, what you want to do is really look at those activities that are higher than the others and saying, is there a way to increase those activities that they're doing? And if there's something that is really a 1, and it's happening daily, is there a way to minimize that? Now, not everything is realistic. Like if work is a 1 constantly, then having them quit their job is not necessarily the best place or thing for them to do. But you really want to see if there's a way that they can start increasing their positive activities, or even the activities that are higher than the others. So if everything is a 5 and there's one activity that's a 6, is there a way to increase the amount of time that they're doing that 6 activity? But really, part of the idea of using that tool and that exercise is to have something concrete and tangible. We use electronic system here, but even with clinicians using this tool, it's always helpful to write it down because, one, they can see it. You have something you can look at together. It gets them out of their own minds and their own heads about the fact that everything is depressing, and then they can actually look at their days and look at what's happening, and it starts to make sense for them in a different way. It's hard when you're lost in your head, and this is a way to kind of branch it out and write it out and just kind of expand it in a different space so that they can take a look at that. I'm going to check in again, see if anyone has any questions. I think this is still pretty straightforward. Move on to the next slide. So the activity monitor is self-reporting. again, it's saying that self-reporting is not as accurate as actually seeing what people are doing, what's happening between that time. It's repeating what I just said. It tends to underreport their positive experiences, emphasizes negative perceptions, and focus more on failures. And really, as a coach, using behavioral activation, you really want to catch people in their successes and what's working for them. And you want to encourage that, and you want to highlight those things. Something that they can't always do for themselves, but also teach them how they can do that on their own, because you're not always going to be there. But partly, as a coach, you're going to highlight them, you're going to recognize them, you're going to see them. And then the other part is that you want to make sure that they can learn on figuring out tools and ways that they can do that on their own when they're actually feeling that these symptoms are coming back, they're not necessarily engaged with a practitioner or a clinician as they're going through them. Next slide. This talks about whether or not you're going to have the client fill out the activity sheet before or after the meeting. I think that really depends on the client or the patient that you're working with, their level of literacy, how engaged they are in this activity. You really want them to fill this out. So if they can do it on their own before, then that's great. If not, it's something that you would spend time doing with them during the session, just to make sure it gets done. But this is something specific to kind of think about with your patient population. And their own level of literacy and comfort in doing these things. And then we work it out. Next. Something that's really important, I think I kind of briefly spoke on it, is the fact that simple activities can have high ratings. Something like the dishes can have high ratings for some and negative for others. And we're not looking for huge, big things. We really want to highlight the successes. We want to highlight the things that have increased that aren't all depressing and all aren't negative. As long as there's any positive to some of the activities that they're listing and some things that they're doing, especially when they're rating it or scaling it, that's what we want to highlight. So on their own, they may not highlight 6 or a 7 as something that's great, but compared to a 2 or a 3, it's so much better than that. It's more positive, and we want to highlight those things. And other times, people think of pleasurable activities as being something that's exciting or adventurous, and they don't always say folding socks as something being really exciting. Mainly because sometimes folding socks is not, because you can't find the other half of your sock and you're stuck with mismatching. But either way, it's something that they can accomplish. If they find pleasure in that and they score that as a 6 or a 7, or sometimes even an 8, we want to highlight those things. We want to take those simple activities, even if they're simple, and as long as they're more positive than negative, then we want to highlight them. We want to show them that that's something they can highlight, so that they have ways of really finding success and really having activities that they can engage in or continue to engage in that bring them more joy than the ones that just kind of bring down their symptoms or increase their symptoms and bring down their mood. Next. So these are some questions to stimulate thinking. Because there's some patients that will talk and talk and talk and talk, and there's other patients that won't, that you're dragging things out of them, and it makes it really difficult for you to kind of get something. Like there's nothing, and this is also partly due with their symptoms of depression. Is there anything that you're doing that's bringing you joy? Nothing. Is there anything that you can rate? I'm not doing anything. None of that is working for me. So these are some questions that you can help them if they can't think of anything. Are there periods of time that you experience enjoyment or pleasure? What kinds of activities seem to give you pleasure? Are there certain times in the day when you feel less pleasure? What activities do you do in the past that you've stopped or reduced? Are these activities you thought about doing but believe that you can't? Are there activities that you thought about doing that you think that you can't? Take the patient down memory lane by asking them to recall memories of past pleasant activities or events. Now, the memory lane one can be kind of tricky depending on how far back someone goes to the things that used to bring them pleasure. And if they've moved to a different city, or if they've come to a different place, or possibly the climate, if they went from the East Coast to the West Coast, the East Coast, there's a lot more winter and there's less winter where they are right now, then there are certain things that they can't necessarily replace, right? They can't necessarily replace winter if there's a place there's no winter. They can't add a beach if they're in a place where there's no beach. But you still want them to have a thought of what was it that I was doing? What activity was I engaged in? And is there something in my space now, in my current situation now, that I can do that can also start resembling some of those things? And maybe it won't be exact, because it doesn't have to be exact. If it's exact, it's great. But if it's not, just something that I can actively get involved in, that I can do that really gets me back into being engaged in certain activities. Next slide. So we simulated thinking. They've thought of some activities. They've been able to fill out the monitoring schedule where we rated it from 1 to 10. We've been able to look with them to things that are a little bit more pleasurable that they didn't necessarily think of. I've rarely ever met someone who's dealing with symptoms of depression that has a 0 on everything, that everything isn't pleasurable, but that may come up. But just in general, most people rate them on different places, and you can come up with an activity and you think about it. Once you've come up with the activity with them, they've looked at the activity that they've wanted to do or they want to do more of, they want to increase, you want to look at the activity scheduling. And this is where you're really looking at scheduling activities and then tracking their progress. So what was really good about the activity monitoring too is that it's very concrete. It's broken down day by day and all the hours of the day. And sometimes people often say, I don't have time to do these things. I've lost all time. And the fact that it's on paper, it's written, you can actually find and look at the time that actually exists and see if there's things that can shift or change in a way that in their minds they possibly don't, but on paper it's probably easier. Or you might look at it on paper and they really have no time to do what it is they want to do. And then it helps kind of really find a goal that's specific and realistic. Because what you don't want is someone to plan on doing something that they don't have the time to do, schedule it, and have it not work out because it was unrealistic to begin with, and then they fall back to their symptoms of depression that contribute to something else that they just failed. So the goal is not to do big things. The goal is to do small activities that they can incorporate into their everyday life that they can start feeling like brings them something different, improves their mood, and that will help improve their overall mood and help reduce their symptoms of depression and have them tackle whatever it is. That's good. Social and physical activities tend to be the most potent mood boosters. So sometimes people will come up with activities of reading a book. I haven't read in a long time, or painting. I really love painting. And those are solo activities. So ideally, you want them to be able to be done in social settings, social activities. Not everything is going to be running or going to a party. If it wasn't someone that was social before, you're not going to force them into social settings. But the difference between reading a book at home versus reading a book in the library, just getting up to go to the library to read is different than staying at home alone to read, or going to a coffee shop to read. All again is social, even though they're doing an activity that's more individual. But the more social, the more physical the activity, they tend to be better mood boosters just because they're engaging with their environment as opposed to just staying secluded in their own space. And again, the idea is that you want to increase daily pleasant events as opposed to just focusing on the negative ones. So if we can increase the daily pleasant events and have it be more social and physical, then the more it can help boost their mood and reduce their symptoms of depression. Perfect. I didn't have to say next. We're in sync now. Activity scheduling. Once patients see the relationship between activity and mood, that the goal is to increase those activities likely to have most impact on their mood. Now, this is a teaching moment. What we're doing, well, during the whole process, we're teaching them what's happening. We're helping them connect the two. As we talk about increasing their activities that are that they used to do, and that we're looking at the mood and seeing the shift in the mood that's coming with it. Now, I believe you're all familiar with the PHQ-9 and screening. I really like the PHQ-9 in the sense of doing it more often, because the more often I do it, then the more information I have. It allows the screener to be a little bit more sensitive to people's moods when they shift or when they change. If you only do it once a month or once every 3 months, then there's a bunch of things that happen in between there that you miss. And as you're doing behavioral activation and you're using PSD or whatever other interventions, the more PHQ scores that you have, then the easier it is for you to really kind of look at the effectiveness of the interventions that you're providing. Because again, you can't always trust the self-reporting of the patients by themselves, because one person's fine and another person's terrible. And the PHQ-9 score or screener at least allows you to have something set up that you can both speak and have the same language, right? Because a 5 is a 5 is a 5, and a 9 is a 9 is a 9. And if you're just counting on how they feel, then you don't always get an accurate amount. And so as you're planning these activities and they're doing them and they're getting engaged in them, doing the PHQ-9 scores every time they come in will really help on top of their self-reporting, or in addition to their self-reporting, really get a concept or idea about how that's been working for them and how that link is happening. So how do we even come up with the activities? You want to generate a list of pleasurable activities, including ones for monitoring exercise that we're looking at in the activity log, and the highest rating. And then you want them to brainstorm on new ideas. What's great about the brainstorming, and it sounds really silly, but it really helps kind of fire off and kick off their mind and dopamines in the head just to really get them thinking and get outside themselves. PSD, there's this whole part that talks about brainstorming, and the very specific aspect of brainstorming and for them to throw things out is just to get them thinking beyond. Now, some people might not have any ideas and some people have some ideas, but you really want them to do this so that they can come up with any possible ideas to figure out what it is that they can do. This is a real big brain exercise. And it also stops you from being the person coming up with all the ideas and activities. You want to get that from them. Now, some patients and clients may say, well, I don't know what I want to do. What do you think would be great? What do you think would be a good activity? But as I said in the beginning, and I'm going to say it again, these are activities that they used to do, things that they were involved in before that they got pleasure out of, or things that they're currently doing that they're getting some pleasure out of that we just want to increase. We're not trying to create new things, really getting them to engage in old activities. Specifically when you're dealing with people suffering from symptoms of depression, going onto new activities becomes a huge, big burden that we're not trying to set them up for. If they can do it on their own, that's great, but that's not our purpose. Our purpose is really to get them re-engaged in activities that they used to do, because it's easier to follow the steps, it's easier to come up with a plan because it's something that they're used to, and if they do it even in incremental steps, then that can help improve their mood. It makes them feel good because they're redoing what they used to do, accomplishing it, and they can move forward. It's important, as it says, that it's the patient that's determining which activities to add to their routine, because that way it becomes more realistic and more specific, and they get to own it. Next slide. So this is the activity log that we were talking about before, where they would list all the activities that they do throughout the day and throughout the week and throughout the times, and then rate them on a scale of 1 to 10 on how they feel when they do that activity. And this is what's going to help contribute to the brainstorming and really looking at what it is that we think, what it is that we can do that can they can increase the positive activities, and if there's anything that they can minimize in terms of their negative activities. Next. Now, this tracking form is what helps kind of brainstorm and come up with activities that they want to do during that week, between the time that they see you and the next time they're going to see you. And this is what they're going to come back in with. So they list a couple of activities that they're going to re-engage in, using it from the activity log that we were looking at and from the brainstorming session. And then they're going to list them 1 to 10 on day 1. And they're going to, after when they come back at the end of the week or during that week, list their mood scores for each of the activities next to them and then have a total. And this we're going to track over time. So we have 7 here. From the time they see you to the time they come back, it's usually a week. Throughout the week, what are these activities? It can be the same activity over and over again, but look at the mood and see how that scores and see if they can track it and rate it, and see if that really kind of helps improve their mood. Again, they don't have to be big. They can be simple tasks. Ideally, we want them to be social. and physical activities just to get them out of their own space and into a new environment or a different environment. New, not necessarily, but different, not in their own home, in their own bedrooms or in their own space. Next. I just want to check in for a second if there's any questions that have come up. Again.
No questions.
Okay, either I'm being very, very clear or this is so straightforward you don't understand why you've signed in, but I'm telling you it's effective, it's efficient. And again, hand in hand with problem solving, this is really helpful. There's a whole component of problem solving in what you're doing behavioral activation, and these are the steps you're going to go through.
Giorgio?
Yes.
It's not, this is Joan, and it's not that you're doing anything wrong or that it's so simple. I think you're doing a great job. This is always a quiet group on webinars. When you get them in a room alone, they're not quiet, but on webinars, they're always quiet.
Okay.
So.
Well, great.
Just
so I'll
go with
it.
And everybody, please feel free to write those questions in. You don't even have to identify yourself. Okay, go ahead. Sorry.
Oh, no problem. Thank you. So, see, I even need some positive reinforcement when I'm doing this. And that's some great coaching. Responding to resistance. Just because we know that we have clients and patients generally who might come up with reasons why not to or why they can't. And you really want to help them troubleshoot through those things. I don't have any money. I'm going to look at some of these responses. I'm not telling you that these are the best responses, but not all activities cost money, even though that we know that money is a huge stressor. And especially when patients are, what's contributing to their symptoms of depression is something very situational. It could be their financial situation at the time. It could be the fact that they've lost a home. They're going through a very particular stressor, and we're trying to get them to re-engage in activity, and money seems to be this huge barrier. So we're not trying to tell them money doesn't matter, but there are things that, and through the activity log, we're able to look at that bring them some pleasure, that aren't expensive, most of them free, that they can continue doing that help improve their mood. So that's one of the things we want to look at. I'm in a wheelchair, so there's nothing I can do. There are activities that can be done. With anything that they give you, really you're trying to pay attention to not create something new. Now, if they were someone who used to run and now they're in a wheelchair and their depressive symptoms contribute, are really around the fact that they've lost their ability to be as active or as social as they used to be in a certain context, it's helping them brainstorm other ways and other things that they can do now that allows them to find another set of activities. It can't be something they used to do, something that they can do, they're doing now, and potentially can engage in that's similar but not the same, but that can still help them re-engage in certain activities that can help contribute to their mood. Is there another way to look at the situation that's true for all of these questions? You can fall into something deeper when it says it's too hard. How does that way of thinking affect you? That brings you into a lot of openings. Again, your goal as a coach in this is to help them find and pick the things that are positive, that are working, that are bringing them some pleasure, and increasing those by either doing them more often during the week or re-engaging in an activity that they used to do and having more time to do those things. Next. You want to be very specific about the activity and the plan they're going to do. The more detailed the plan, the more likely it is to be followed. So you want them to pick a day or time of the week, how long, who are they going to do the activity with, and all the other aspects that they need to do. The more specific, and that's what's great using the activity log, because you actually get to see what their days look like and what times and what happens. So it's easier to kind of plot it out in a very specific way. The more specific, the more direct it is with a very specific set of times, is that one, it helps them kind of really plan for it, think about it, visualize it, and then they can see it in the schedule in a way that becomes realistic and they can actually handle it. The other part that's just as important as scheduling something very specific is make sure there's a backup plan. right? Just to make up for the fact that sometimes their plan can be great and can be amazing, and then something comes up. And if it gets deterred, you don't want them to get fully fall back into this depression because they weren't able to accomplish their goal. You really want to come up with an alternative plan. So if that doesn't work, what would you do here? If it's raining that day and you're planning on going to a run and you don't have the rain equipment, what else can you do, right? If for whatever reason the place you want to go to is closed, what's something else you can do while you're out of the house already that is going to be helpful and useful and can be done? So specific, detailed, the person that's going to do it with, if that person is not available, is there somebody else? What can they do? You really want to come up with backup plans. A lot of this is to prevent those feelings and sense of depression of when the activity isn't happening, because we know that a lack of activity contributes to symptoms of depression, and symptoms of depression contribute to a lack of activities. And you really want to think of both those things as they're planning their activity. Next. So in reviewing the progress, again, I was saying this before, is that as a coach, you really want to identify their successes. You want to help modify the list of activity based off feedback. If they got to do some of the activity but not completely, maybe it needs to be adjusted. Maybe the amount of time they spend on it needs to be reduced. I don't know if any of you have done motivational interviewing. We don't talk about the praise. We talk more about affirmations. But you really want to be the person catching them on the successes that they're making, helping highlight those things, and really making sure that they know that they've been able to have some success and some movement in what they're doing. And if there's things that didn't work, you want to talk about those, look at obstacles, troubleshoot for those. And if they weren't able to do it at all, then the activity could have been wrong. Maybe they needed to use a different activity, something else that brings them joy, something else that they can succeed in, and then you guys can set up a whole new set of goals and to move forward. If they're successful in what they're doing, then maybe it's just increasing the time. It doesn't have to be big. It doesn't always have to be new activities. For the same activity, it's possibly increasing how often they're doing it, how long they're doing it for, and possibly another aspect of it. Next. Be always prepared to modify. You want to let them know that being able to modify doesn't mean that they failed. It just means that what they're doing is adjusting it to make sure that they can succeed. Anything that deals with barriers, cultural considerations, what is successful for them, and also what you can see and what you can help them recognize as successful in terms of the goals you're setting. Just like problem solving, you're looking at very measurable goals, very specific goals, and the same thing with the behavioral activation. If they surpass the goals that they set with you, if they decide that they want to go for a walk around the block as the goals that they set, and instead they went for a 25-minute walk, that's great. They can surpass them, but as long as they're surpassing them and they're setting them up as realistic enough that they can surpass, you're going to highlight the success of it. Next. So some useful questions to facilitate a review of behavioral activation is, how did the client feel when engaging in these activities? Has there been a disruption in their routine? And what's getting in the way of them completing this event? This again allows you to look at how you can modify, how they can modify, how you can come up with an alternative plan and possibly pick another activity. Next. Helpful tips for clients: action, assess what's making me depressed. And this is something for them to use on their own without the clinician being there. Assess what's making me depressed, choose to self-activate, try new behavior, integrate new behavior into routine, observe results, never give up. With the tools and the two activities that you looked at, the activity monitoring, the scheduling, and modifying are ways that clients can walk away and be able to do this on their own. Next slide. So in summary, again, it's broken down into real easy steps. It's the activity monitoring, the activity scheduling, and the modifying. Takeaway message, next slide. The one that I really like the most there's 4 pleasant activities a day keeps the blues away. But the one I really like is that they don't have to be huge, just consciously chosen and deliberately done to experience control. Helping clients really be able to gain control. That is huge when you're dealing with people that are dealing with symptoms of depression. And it's really important that what you're being able to provide for them and allow them to do is regain control over a part of their lives at a certain time in their lives where they're feeling that they have a lack of control. That's it for now. I don't know if anyone has any questions. I know I pushed this all the way to the edge of our webinar, but I think this would be the time if people have questions, comments, objections, if any, just to let me know, and I can probably talk through them.
Great. Thank you so much, Giorgio. That was awesome. So before we begin, we did get a few questions in, so I'll go ahead and ask you those, but I also wanted to point everyone's attention to the handout pane. Giorgio mentioned a few different resources throughout the webinar, and we've uploaded 2 different handouts. One is, I believe, the activity logger, and then, Giorgio, what was the other handout you sent?
There was the activity log, and then there was the tracking form.
Perfect. Yep, so folks can download that at any time. It's easy access right in your handouts pane. So again, we're happy to answer some questions now. You can send in your questions via the chat, or you can hit the raise your hand icon, and we can unmute your line. If you'd like us to unmute your line, just be sure that you entered your audio pin. So without further ado, Giorgio, we have a great question that came in, and it says, given the stages of change, at what stage can you use behavioral activation?
Well, so with behavioral activation, you're walking them through the different stages, right? So when we're looking at the pre-contemplation stage, behavioral activation is not actually trying to create a full change. It's really trying to re-engage them in an activity. So when you're looking at motivational interviewing, you're thinking behavioral stages of change, is that whole motivational interviewing is trying to get someone to a place through a collaborative conversation where they can really own their change and move into this next section. In problem solving, they're walking in and you're helping them pick a very particular problem to address or to look at in a way to kind of address that. So regardless of where they are in the problem stage, problem solving kind of walks them through kind of all the stages into action planning and possibly doing it. And then we have the last, which is behavioral activation, where in behavioral activation, what we're trying to do is, again, kind of fast forward through the idea that you're thinking about the stage of stage in like kind of the normative way that we think about it, but more in the sense that you're walking them through something that allows them to re-engage in activities that they used to do. This isn't supposed to be something in which they're struggling with a problem per se, but more identifying things that they've done and they're doing right now that they can easily get back into doing. Does that make any sense?
Yeah, that was great. I know, Jocelyn, you are the one who asked the question, so if that's not clear, feel free to raise your hand and I can unmute your line, so if you have any follow-up questions. Great, so do we have any other, oh, Jocelyn says that works for her. It clarifies everything, thank you. Great, so does anyone have any other questions? Type it into the Q&A box or raise your hand. Okay, well, so it doesn't look like there are any other questions. So I think we'll let folks off a few minutes early. Everyone will be happy to have a few minutes back of the day. So thank you again, Giorgio. That was really great. And thank you, everyone, for attending today's webinar. As a reminder, again, once you leave today's webinar, you'll receive a survey that will pop up on your screen. And we really appreciate if you could complete this and provide your feedback. It helps us improve our future webinars and improve future technical assistance. So thank you again for joining us, and please enjoy the rest of your day and the rest of your week. Thanks, everyone.
Thank you all.